Thank you, John Paul. Now, that's one of the reasons why programs like the one we're about to tell you about exist. This is a one of a kind. It's happening here in town. Staff from Trauma One hospitals teaming up with a local program to step in and intervene when a shooting breaks out. The whole point is to reduce gun violence. The 19's Patty Santos tells us more about the expanded program called Stand Up SA.
Most people don't have the credibility they do. Most people can't talk to somebody. They don't want to be in a room with guns and say, put the gun down. Most people don't have that courage.
Now members of Stand Up SA will be taking their credibility and courage into hospitals. It's a new initiative that expands the mission to stop gun violence and gang retaliation in our streets.
When a person is in the hospital, they're at their most vulnerable state. So basically at that time, they're pretty open to listening, to reasoning.
Dennis Ellis, the hospital supervisor for Stand Up SA, is part of the new team of 3. He says they'll work at University Hospital and BAMC, both level 1 trauma hospitals, where the most serious of gun shooting victims are treated.
We're just trying to save lives. That's what we're doing. We're trying to stop gun violence, you know.
Derek Taylor, Stand Up SA coordinator, says this is the first of its kind in Texas. It follows the model of crime prevention efforts in other major U.S. cities, working with hospitals to offer shooting victims a way out of the line.
My team has been there. They've done that. They made their life change. So now they want to help somebody else make their life change.
Trauma doctors certainly concerned about the rise in gun violence, saying the number of gunshot victims coming into this hospital has nearly doubled in the last 2 years.
We see, unfortunately, a fair number of children and young people being injured.
The adult trauma medical director at UHS says it takes a toll on staff to see young people seriously hurt or at times lose their lives to gun violence. So they're committed. They will support them in any way they can to stop the cycle of violence.
And this is nothing new. We've seen it time after time, but a lot of our patients unfortunately come back again with second injuries. It's not uncommon for some of these types of firearm-related injuries to happen to people more than once.
And the goal is to hopefully get this hospital program going by this spring. And Steve, Stephania, the other thing that's unique about what Stand Up SA is doing is that this hospital program is mostly done in public, private hospitals. This is the first time that a military hospital, BAMC, is going to be involved. Back to you.